The information shared on the Sky Women's Health podcast is for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding your medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. Reliance on any information provided by Sky Women's Health, Dr. Carolyn Moyers, or any guests featured on the podcast is solely at your own risk.
You're listening to Sky Women's Health Podcast, your evidence-based resource for women's health and wellness, exploring the holistic principles of osteopathy, integrating mind, body, and spirit, designed to empower you as your own healthcare advocate and help you live your best life. I'm your host, board-certified OBGYN, Dr. Carolyn Moyers.
Hello, friends. Welcome back to Sky Women's Health Podcast. I'm so glad you're here. As we come to the end of 2025, I wanted to slow down and reflect with you for a moment. I'm actually recording this night before release after a week of spending some really meaningful time with family, one-on-one time with each of my kids, and my heart feels very full. It feels like a perfect time to just pause, take a breath, look back on the year that brought growth and courage, learning, and some big shifts, both personally and professionally. So today's episode is a year-end reflection and a chance to share what's changed, what stretched me, what I'm proud of, and what I'm carrying forward into 2026. And as always, my heart is, or my hope is that somewhere in this conversation, you'll hear something that resonates with you on your journey too. So this podcast continues to be one of the most meaningful parts of my work, although it continues to stretch me to find time to have the conversations. But we've spent this year having honest conversations about perimenopause, menopause, sexual health, pelvic pain, bone health, stress, sleep, work, topics that are still too often minimized and brushed off in women's healthcare. And what stays with me are the messages. I didn't know this was menopause. And I finally feel like myself again. Dr. Moyers, I listened to your episode and I learned so much. There's so many times when I thought, is this really worth doing? And yet you keep letting me know that you're listening. And it blows my mind to know that over 1,000 women are listening to these episodes. It's just amazing. I think of this podcast as an extension of the exam room, education without the clock running. And your engagement this year reminds me of how needed these conversations are. And the goal is to help you be your best healthcare advocate, whether you're seeing me or not. One of the things that's brought me the most joy this year was stepping outside of the clinic and into the community. So I've had the opportunity to speak at Canyon Ranch with Sproul Magazine and Tatiana Miller, which was amazing and sold out. We had to do 2 sessions in the same night at Brick Gym and at Richard Country Club. And these are just women who were seen to have important conversations. Because so many women aren't necessarily looking for menopausal care yet, or they have a lot of questions. They're just wanting to, try to get their workouts and their get through their work days and their relationships, and wondering why they don't feel like themselves anymore. So being able to show up in these spaces, gym and wellness retreats and community rooms, and have these open conversations about hormones and pelvic health and sexual health and bone health and aging felt deeply aligned with my mission with Sky Women's Health. And this is what I mean when I say meeting women when they are, not waiting until they're burned out or just feeling completely dismissed, but starting the conversations earlier in places that feel more accessible and safe. This year, Sky Women's Health, let's talk about the growth, okay? This year we have grown by 40%. But what matters most to me is how we grew without sacrificing longer visits, individualized care, our osteopathic principles, or treating menopause and sexual health as optional side notes. They are front and center. One of the milestones that really stopped me in my tracks was that we surpassed 100 patient reviews as just a small practice. This is phenomenal. Over 100 women took time to share their stories about feeling heard and validated and truly cared for. And that's not just growth, that's trust. So thank you to everyone who left us a review. All right, let's talk about learning to get help and why did I not do this sooner? This year also taught me an important lesson about sustainability. In May, I finally hired podcast support. As the tech became more complex and labor intensive, I was spending hours doing things that someone else could do in just minutes. And I remember thinking, why did I not do this sooner? This is such a common pattern for women, especially women physicians. We're capable, we can figure it out, we can push through, but doing everything yourself eventually becomes a barrier to growth. So, getting help didn't mean I cared less, it meant I could show up better. So, thank you to my podcast producer, and he and his wife are a phenomenal team, and I'm just so grateful for the support that they give us. All right, I want to share something honestly with you. So, for the entire life of Sky Women's Health, I have worked a second job. This has allowed me to reinvest in the business and ensure that I got paid without compromising the integrity of the care that we provide. But after a lot of coaching, financial planning, and really acknowledging the demand for this care, I have made a big decision this year. I gave notice at my local job. We are officially going all in on Sky Women's Health, and it feels exciting, maybe a little bit scary, but there's an important mantra here that I've been carrying with me. What would we do if we weren't scared? So I encourage you to ask yourself what you would do if you weren't scared in 2026. So this year has also included significant personal growth, attending the Menopause Society annual meeting and completing the International Society for the Study of Women's Sexual Health full course with the hands-on portion for sexual health training, and it was phenomenal. These experiences reinforced something that I already knew: women's midlife is nuanced and complex and has been underserved for decades. And that's why one of the biggest milestones this year was launching the Menopause Masterclass. So at drcarolynmoyers.com, this is a course for physicians, physician assistants, nurse practitioners, because for nearly 2 decades, medical education has failed to prepare us to adequately treat menopause. And if we want women to receive better care, we have to train the people providing it. And while in years past we've had over 1,000 menopause certified providers in the United States, we're now at 4,100. That's 4,100, which is tremendous growth. But so many more women are going into menopause every day. So we have got work to do. We need everyone who's treating women to be aware so that we can get women the care that they need. Let's talk about some real advances this year. Let's zoom in for a moment on some of the things that made headlines. So the FDA removed the black box warning from the estrogen-only hormone therapy, allowing for more science-based conversations instead of fear-based ones. And we did a whole podcast episode on that. The American Urologic Association updated their guidelines for genitourinary syndrome of menopause, recognizing that GSM is chronic, progressive, and clearly supporting vaginal estrogen or DHEA are safe and effective options for most women. And I was approved for postmenopausal women. So finally acknowledging that sexual health matters at every stage of life. This has been approved for, and Addie is the little pink pill that is used for hypoactive sexual desire. It has been approved since 2015 in the United States, but a limitation was put on it for premenopausal women. It's been approved in Canada since 2020 for postmenopausal women. And so now in the US, just this month, we had approval for postmenopausal women up to the age of 65. So that is exciting to know that we have more extensive use on this product. Now, is interesting. Someone are like, is it really going to work for me? We don't know unless we try. We need to use it consistently for at least 2 to 3 months. The response rate is around 50 to 60%. And if it works for you and it's decreasing the distress of a low sexual desire, and some people feel like, oh, that may be insignificant, but if you're having 2 to 4 more sexual encounters that were gratifying than you previously did, or maybe you were previously avoiding sex, this is huge for many couples. So, Addie being approved in postmenopausal women is a big win because that's going to improve our access of care and maybe improve insurance coverage. All right. This is progress and it gives me hope. There are many good things that have happened this year in women's health, even though there's so many things in the obstetric world that feel like we're losing the battle. We're going to take our wins where we can get them. All right. The most listened to episodes this year focus on menopause myth busting, sexual health, stress, sleep, and pelvic floor dysfunction. And this tells me that women are really craving clarity, validation, and practical guidance, not dismissal. Okay, let's talk about some personal health wins. So, I also believe in modeling what we ask of our patients. And this year, I had my first colonoscopy. The prep was not fun, but I got it done and had a great nap during my colonoscopy and was excited to have a clean bill of health. Although they did find one polyp, and I will have to have it repeated in 5 years. I also am just 2.5 weeks after having an anterior posterior colporrhea with a single incision sling, and I keep asking myself, why did I wait 12 years to do this? I did biofeedback, I did all the pelvic floor physical therapy, and just simply did not get the relief that I was looking for. So I am, not fully healed yet or cleared from surgery, but doing really well, and so glad that I did it. It's just a reminder of how women normalize discomfort, especially pelvic floor issues. And I want you to hear this clearly. You don't have to just live with it. There are a lot of options. And I am so grateful to my amazing surgeon, Dr. Chowdhury, who did a fabulous job. All right, let's talk about looking ahead into 2026. As I look into 2026, I am excited for what's coming, expanded patient courses, member access, monthly webinars designed to continue these conversations beyond the clinic walls. And I'm carrying this question with me into the new year. What would we do if we weren't scared? Thank you for being a part of this community, whether you're a patient, a listener, someone quietly learning along the way. Here's to bold, informed, and empowered 2026. Until next week, be well.